Hey, welcome to the Nursing Dose with your host, Dr. Farah Laurent. Today, I'm going to get straight into it and talk about tips and strategies for brand new nurses who are looking to get hired faster and who are struggling with the interview process and struggling with interview questions. So, today, I'm going to talk about the do's and don'ts of nursing interviews. So, let's get into it. You'll also have the opportunity to ask questions at the end. I will also if you happen to be watching the replay, I will also go back into the comments to answer any questions that you guys may have. And of course, I want to invite you right now to my free webinar this Thursday. It's going to be at 1 p.m. Eastern, 10 a.m. PST. This webinar is specifically designed to help you with all of your job search questions, all the strategies that you need to be successful in the interview. And also, I will share my proven framework that has helped over 200 new nurses land their dream role in preferred specialties like the ICU, the ER, L&D, NICU, in competitive areas like San Francisco and New York City. So, for those who don't know me, my name is Dr. Farah Laurent, and I am board certified, over 20 years of experience, master's in education, and a doctorate in organizational leadership. I've been featured in media such as the Jennifer Hudson Show for the work that I do for new nurses. So let's get into it with my do's and don'ts. Okay. So the first do that I will share is for a new nurse that is about to prepare for their first interview. You definitely want to have an interview pitch. Okay. Most new nurses make this mistake of not having an interview pitch and going into the interview unprepared. So, what do I mean by the interview pitch? 100% of the time, like I would say 99.9% of the time, they will ask you this first question. They will say, "Tell me about yourself," or "Walk me through your resume." It's essentially the same question, and it's your time to introduce yourself. Now, the interview pitch is something that you prepare ahead of time, that it's about 60 seconds to about 90 seconds. And I have a whole framework on this that I will break down for you. And it's not the time to think about that answer when they're asking you. You literally should be prepping this weeks and weeks before your interview. And this is exactly what I break down in this webinar that I'm going to be hosting this Thursday. So definitely go and sign up at newnursejob.com or just go to the link in the bio and get signed up for this free webinar. So let's break down what an interview pitch is. It's essentially your unique value proposition. It's you marketing and promoting yourself and introducing yourself in a way that stands out from all the other candidates. I've helped clients that were on panel interviews with multiple candidates, but their answer stood out the most because we prepped it. Okay. So, how do you start this interview pitch? This is the framework. The first part of the pitch, there's a 3 parts that I teach. The first part of it is do not introduce yourself in the traditional manner. Don't say, "Hi, my name is Farah. I went to this school and I'm interested in the ER." No, that will not get you hired. It's the same boring introduction that everybody does, and you're going to sound just like everybody else. And that's not what we want. We want you to stand out. So, the way that you introduce yourself is be a disruptor. Say something that is going to shock them, something they're not expecting, or start off with a statistic. So, one of my favorite things is, for example, if you're interested in women's health, I've actually guided one of my clients to use this specific introduction. And of course, you tailor it to your truth and your past experience, right? So we start out by saying something like this. I'm actually really interested in women's health because I want to be an advocate for all moms. I'm tired of seeing that Black and Brown women are dying 3 to 4 times more likely than their counterparts when these things are preventable. So, this is the specific reason that led me to go into nursing to specifically pursue labor and delivery. I've seen my family members go through birth and, postpartum, and I actually enjoyed really taking care of them. But later, when I grew up, I saw all the disparities that existed. So I want to be part of the solution. And this is why I'm here today, to make a difference and be part of your team. What I learned in nursing school was amazing. I loved all my clinicals, but I was always drawn to women's health, specifically labor and delivery. When I was there, I really thrived. I was so passionate. I connected well with the patients and their families. I advocated for them. And my clinical instructor even wrote me a recommendation letter so that I could start my career in L&D. I love critical thinking. I love being in fast-paced environments, and I really thrive in these environments. And this is why I know that I'm meant to be an L&D nurse. Fast forward, why this particular hospital system is because I've done a lot of research. I know that you guys have really good statistics. You have low C-section rates, and you have really good outcomes for the moms. And literally, I want to be a part of this team because I believe that every mom and baby should leave the hospital healthy and happy and be able to go home with their families. And I'm so excited to start my journey here on this unit and to start my career. So again, thank you for the opportunity. I'm so excited. Something like that. Okay. I know it's just kind of off the cuff, but this is what I tailor specifically with my clients who join my coaching program. And again, you get a little bit of this in the webinar, but that is an interview pitch. The interview pitch is not you just going to the interview and thinking about how you're going to introducing yourself when you're on the spot. So I hope that was helpful. That is literally what got one of my clients hired directly into labor and delivery and got a same day offer. Many of my clients get same day offers because they are so prepared for their interview and they literally stand out. Okay. So that's number one. You do want to have an interview pitch and you want to prepare it weeks in advance. Okay. What you don't want to do is have it just, be something that you just ramble and put together last minute on the spot. Okay. Number two, you want to prepare for your preferred specialty area that you're interviewing for. Let's say you have a telemetry interview or a cardiac ICU, whether it's CT-ICU, CV-ICU, something specific to critical care, whether it's ER, ICU, or let's say telemetry. You know that they're going to ask you critical clinical style questions, okay? They're not going to take it easy on you. They're going to ask you some questions that you should already know, okay? So they might ask you some arrhythmia questions. I had one particular person that came to my webinar and had a quick convo with her after, and she said that they literally, I think this was one of the hospital systems in the Los Angeles area, that they literally put up a case study with an EKG, and they asked her what was going on in that EKG and what she would do next. Okay. So this is why when I tell my clients, like, make sure you invest in yourself, you get ACLS, PALS, take an ECG, EKG course. I'm not just saying it for fun so that you can just spend money. No, this is an investment in yourself, an investment in your future, in your career, and it'll help you get hired faster and you'll be a better nurse because they're definitely going to ask you clinical style questions. Okay. So obviously you're not going to go to a telemetry or cardiac type unit and not expect to be asked cardiac questions. Okay. It sounds silly, but that's exactly why people are not doing well in their interviews because they're not preparing for clinical questions. All right. If you're going to the ICU or to the ER, guess what? You better know about sepsis. Okay. Sepsis is one of the main things that happens to patients in the hospital. So if you can't explain sepsis, you don't know the rationale, you don't know the interventions, the signs and symptoms, some of them will grill you. As a former ER nurse, I know because I used to be involved in these interviews. And I actually have a really specific clinical style video on YouTube because I just started a YouTube channel earlier this year. So go check that out. I think that's like the top performing YouTube video. It just hit like 12,000 views. So go check it out. I think it's called Every Clinical Question That Like Every New Grad Should Know. And how do you access my YouTube channel? Just literally type in my name, Farah Laurent YouTube channel, or go to The Nursing Dose with Farah. Okay. And again, this is why you should attend my webinar this Thursday so that you have the opportunity to ask any questions about the job search process or about the interview process. Okay. And how do you join my free webinar this Thursday? Simply hit the link in the bio or go to newnursejob.com and you'll be able to directly access that webinar link. So you just type in your name, type in your email, and I think your phone number, and then you'll get an email with the specific Zoom link. Okay. But sign up now because when spots fill up, that's it. You'll have to wait till the next one. Okay. So if you're just joining me, I'm talking about do's and don'ts for interview questions specifically for new graduate nurses. Okay. So the first one, we talked about mastering your interview pitch. Number 2, prepare for your preferred specialty area. Okay, so you need to know all of the related questions that will be asked in your preferred specialty. So let's say you're going to apply to a NICU position, neonatal ICU. You, number 1, should have NRP before you even step into that interview. Most people will not even give you an interview if you don't have NRP, which is the equivalent of ACLS, but for neonates. It's called Neonatal Resuscitation Program, NRP, okay? Some of you that may be watching and thinking like, hey, I'm not even getting interviews. This is part of the problem. The reason you're not getting interviews is because you're not positioning yourself to get interviews. So baseline entry is you need to have all the certifications needed for that specialty. If you want to get into labor and delivery, then you need NRP, you need ACLS, and you need fetal heart monitoring at the basic level, okay? And then your resume and cover letter should stand out for you to get to the interview phase, all right? So of course, if you're going to NICU, if you're going to L&D, you need to know the most common complications that happen with those populations. So for example, labor and delivery, you need to know so many things that can happen, right? One of the biggest things is hemorrhage, right? So you need to know that. You need to know things like preeclampsia or eclampsia. So it's like taking you back to nursing school. Yes, I know, but you need to know your clinical stuff because they're going to ask you, okay? So again, prepare for your specific specialty. If you're going to be in the ER or the ICU, you better brush up on all your emergency stuff. Like I said, in that YouTube video, I cover all of it. I cover how to assess a patient, how to prioritize, and how to go through all of the major things like sepsis, chest pain, STEMI, strokes. All of that is in that video. So go check it out. And of course, come to the free webinar where I'll break all of this down even more for you. Okay. Number 3, okay, is you need to identify what the interviewer is actually asking you in the interview. So many people are like so quick to answer and they don't really process what the question is asking. So you need to figure out, what is this question really asking me? Okay, so some questions are like assessment style questions where they want you to go through how you will assess the patient. Okay. Another thing is prioritization. They might give you 3 or 5 patients and say, hey, which one would you see first? and tell me why. Okay. And we'll go through that a little bit later, which is the rationale. And then number three, they might want to evaluate basic safety, right? Like, do you understand some basic safety type questions and how to prevent, for example, falls or how to prevent infections, especially if you're going to a post op unit. If you're interviewing for a post op unit, you better know all the things to prevent infections, or at least how to educate on it. And if you spot any signs of infection, and also how to prevent sepsis, or if you detect sepsis. Okay. Any post op unit, you better know those things. All right. And then another one is communication and teamwork. They might want to just know how you communicate with the team or with the patient and families. Are you able to communicate effectively in a timely manner? Sometimes they ask questions like, hey, you get this critical result. How would you communicate it? Who would you tell? How would you move about, this situation? And then it leads me to my other one is how you handle emergency situations. They want to know, number one, are you able to detect a change in condition in a patient? And are you able to recognize that it's a change? And what are you going to do about it? How are you going to escalate it? And what interventions are you going to implement right away if there needs to be something done right away? And how are you going to move forward? Okay. And you might need to describe exactly what you do in that emergency. Okay. So things like, for example, stay with the patient. If the patient is short of breath, put the head of the bed up. Depending on what unit you are, you can potentially deliver oxygen if you're able to as a nurse in that capacity. Definitely if you're in the ICU or ER, you're able to do things like that. Or, you're calling the team for help. You're notifying the attending physician, or you're calling a rapid response depending like where you are, what facility you're in. Okay. So again, coming from a former ER nurse and a former educator and a former clinical instructor, these are the things that I bring to my coaching program, and I bring to this webinar a different perspective than most. So if you're just listening to your friends, listening to your family members, trying to do mock interviews with people that know nothing about nursing, this is why you're not getting offers. Okay, so come to the webinar this Thursday at 1 p.m. Eastern, 10 a.m. PST. Sign up now. It's free at newnursejob.com, and the link is in the bio. Again, this is for any new nurse that is interested to get hired faster in their preferred specialty. You'll also learn about my coaching program. Again, not everyone is eligible for my coaching program. If you do meet criteria, we'll go through that. And then you'll also have an opportunity to speak to me one-on-one and book a one-on-one consultation call to see if you can move forward into my coaching program. I also have a course that I offer. If you don't meet criteria for the coaching program, you can also purchase my course. But again, in this live webinar, I'm going to be dropping a lot of gems, a lot of tea, strategies, and proven frameworks that have helped new nurses get into the ICU, the ER, NICU, all of it. And I'm doing it for free. So why not sign up, right? Okay. And then number 4, some of the do's is you're going to have to explain the rationale behind your answers. Some interviewers want to know your thought process and they want to know how you think. So you might have to explain the rationale. So let's say they ask you something about sepsis and you give them an intervention, they're going to ask you like, why did you do that? Or if they ask you a priority type question and then they say, well, why would you see that patient first? Can you break it down for me? They want to know your thought process and how you think. Okay. And then number 5, simply put, you need to know your ish. Okay. You need to know your stuff. You need to know your clinical stuff. So if you have to go back to your textbooks, read about sepsis, read about chest pain, STEMI, NSTEMI, stroke, hemorrhagic stroke versus ischemic stroke, you need to update yourself on all of these things because they're going to ask you in your clinical style questions. And this is one of the top reasons why most people are not getting offers, because if you're not a strong candidate clinically, you don't sound competent and you're not confident in your answers, you're not getting the job, especially if you are applying for critical care positions. Okay. And like I said, bare minimum is you need to invest in yourself in terms of getting certifications. And then you need to learn how to pitch and promote yourself. Okay. So if you happen to be watching the replay and you're like, I'm super interested, how do I sign up for this webinar? You could still use that link, newnursejob.com. Make sure you sign up because when spots get filled, you got to wait for the next one. The link is on the bio on TikTok, Instagram, YouTube, LinkedIn as well. And I'm not sure about Facebook, but simply just go to newnursejob.com. If you guys have any questions right now, let me know. Let me know if you signed up for the webinar. Drop it in the chat. And who is this webinar for? Like I said, any new graduate nurse, or maybe any nurse that's in a current position that, like, maybe you hate your current position, you're miserable, maybe you're on long-term care, nursing home style, and you want to transition into an acute care position. You're like, it's time. I don't want to like mess around any longer. I'm tired of waiting. Oh, thank you, Haley. Haley says, I love your YouTube videos. I appreciate it. Thanks for letting me know. Yeah, and if you want to check out my YouTube videos, they're totally free. They're super helpful and valuable, as Haley is saying here. So you can go to the Nursing Dose with Farah and click on videos, because you'll see lives, and this is under lives. You don't want to hit that. You want to hit videos, and then you'll see all the thumbnails, all the different videos that you can click on, and you can subscribe to them as well. I drop a video every single week, and they're specific to new nurses. Okay, all the tips and strategies are specific to new nurses. And then I also have the link to the webinar in the description on my YouTube channel as well. Okay. And many of my YouTube viewers have actually joined my webinar, booked a one-on-one call with me, decided they were interested in my coaching program. We walked through it, and those who were eligible to join, and of course, there's an investment, join the program, and some of them have gotten hired already. Okay. So like I said, join the webinar. It's free. You know, even if you decide you're not interested in the coaching program, totally fine. But go check out my YouTube video. Tell your friends, subscribe, bring a friend, and you can tell your friends about this webinar as well. Have them sign up early if they're interested, because like I said, once they fill up, that's it. Like for this Thursday, I already have a bunch of people who have signed up. I think I'm at like 30 or so people. So it's going to hit the max soon. So make sure that you sign up right now. newnursejob.com. Let me know, Haley, if you signed up for my webinar. I don't know if I've seen you yet on my webinars. So thank you for letting me know that you find my YouTube channel is helpful. Let me know if you have any questions, comments, drop it in the chat. Even if you're watching the replay, I'll go back and answer any questions that you guys have related to job search strategy as a new nurse, or even as a senior nursing student. Because guess what, y'all? Even if you're a senior in nursing school, you can start applying for jobs now. I've actually had many clients who are still in nursing school that joined my coaching program, and we got them to secure an offer before they even graduated. Okay. So Haley says, I graduated in a year, can't land a CNA job. What can I do to get a head start to get a new grad job? Yeah. So if you're graduating in a year, I definitely say keep applying for CNA and PCT positions. And let me know where you want to work, because one of my past clients, Savannah, actually strategically got a PCT job in the ER because she wanted to work in the ER when she graduated. So as a nursing student, she got a PCT job in the ER. So that's what I recommend. Like, let's say you want to work in a particular specialty, then get as close to that specialty as possible. So like, let's say you want to work in the ICU and like maybe where you are, there's no ICU PCT position or CNA position available, then take something close to that. I would take like telemetry. Let's say you want to get into the ICU, but you can't. Go into the ER. Let's say you want ER, but you can't get there. Become a PCT in the critical care units like the ICU. You see what I'm saying? Go to kind of where you want to be. If you want to be in the NICU or labor and delivery or postpartum, get yourself a job there. Let's say you can't get a CNA or PCT job on an L&D unit or NICU, find something else, like become a transporter or a unit clerk. So you immerse yourself in that particular unit and try to get a job like at your preferred hospital system. So like, let's say you're in California and you really want to work at Kaiser or Sutter or Cedars-Sinai or whatever it is you want to work, Stanford, get a job there. So then it'll be easy transition because you're already be in the system, you'll be networking with people, and it's an easy way in, okay? If you're in the New York City area, same thing. If you want to work at NYU, go get a job at NYU. I used to work at NYU Tisch campus. And it's obviously the number one health system. But yeah, get close to where you want to be. IC would be the goal, and she's also in Cali. Okay, cool. Yeah, no, you don't need to leave California. Okay, everybody tells you that. You can stay in California if you want. Actually, 80% of my clients are from Cali. All right. And then thank you, Nicole. Nicole Gonzalez says she signed up for the webinar. Cool. Super excited to meet you. Let me know what specialty area you're interested in, Nicole, and tell me what city you're in. Just curious to know. All right, y'all. I have been missing a little bit. I typically do these lives like 3 to 5 times a week, sometimes 1 to 3 times a week. But I was on like vacation, had some stuff to take care of. So I promise, and keep me honest, I will be on here at least 1 to 3 times a week. I'll be doing these different live sessions. So look for me. You can always watch the replay on YouTube of these lives and also on LinkedIn. If you're not connected with me on LinkedIn, make sure you connect because that's where I'm most active. Christelle says, hello, you don't have Florida? I'm not sure what your question is, but all my information is applicable to any nurse in the US, any nurse in Canada. I used to work in Canada as well, and even Australia and the UK. Okay, yeah, definitely take advantage of your clinicals. Go talk to nurse managers and stuff like that. Have your clinical instructors make a warm introduction and have them like take you to the ICU units and introduce you to the nurse managers there. Okay. So Crystal, I don't know if you can verify your question. I'm not sure if you have a question specific to Florida, but pretty much all the content that I share is applicable to any state that you live in. All right, so cool. Nicole says she's in Corona, California, looking to get into psych or correctional nursing. Okay, cool. Yeah. So we definitely will talk a little bit more about that on the webinar. You can also join nursing organizations, like probably for psychiatry if you're interested in that. And same thing with you, if you're interested in ICU, join the AACN. For ER, it's the ENA, so on and so forth. Okay, so I'll drop more content. And again, check out my YouTube channel. And most importantly, make sure you're signed up for my free webinar this Thursday, newnursejob.com. The link is in the bio, and I'll see you guys next time. Thank you for watching. And Nicole, can't wait to see you on my webinar this Thursday. I'm excited to meet everybody who has signed up, and I'll see you soon. All right, take care. Bye, y'all.